Hello everybody, this is Dr. Tyler Evans from Upper Chiropractic. I'm coming at you live with the research moment today, and I'm holding my ear because I want you to listen and because I'm talking about manual therapy and ear pain today. Not earaches, not ear infections, not Meniere's, not anything else other than just pain in the ear. Oftentimes it can be bilaterally, both sides. Comes on quickly, kind of comes out of nowhere, don't really have a reason why it started. And these 4 cases that are reviewed in this paper here, it's called Manual Therapy and Ear Pain. Let's see. Yeah, Manual Therapy and Ear Pain. A report of 4 cases. Let's see if that looks better now. That didn't correct the problem. Okay. Oh well. Anyways, I tried to flop the screen there, but it didn't work too well. So anyways, the paper I'm reviewing today was done back in 2011 in the Journal of Canadian Chiropractic Association. It was done by a large office that had 20 doctors, and they just had some cases. They had 4 cases where ear pain had resolved quite quickly, actually within 5 to 10 visits for all of the patients, usually within 5 visits. And it had been resolved via a combination of things, but one thing in particular was correction of the top 3 neck bones, C1 right here, C2, and C3. And those are the upper cervical vertebra. Now, the 4 cases, I'll break it down real quick. The first case was a 26-year-old woman who complained of bilateral ear pain, which had developed kind of insidiously or came on without any cause 1 month previously. They diagnosed her with a little bit of TMJ dysfunction and upper cervical joint dysfunction, C1 and C2. So what did they do? They did 5 treatments of upper neck, gentle corrections without any twisting or popping, because she said she didn't like that. And that's actually what upper cervical chiropractors do every day in our office, is we gently, specifically correct the top 2 neck bones to help the brain work better, to help the nerves in the head and the neck and the rest of the body, because all the nerves come from the brain down through the body and communicate back up to the brain. And that little pathway through the neck has got to be in alignment. If it's not, C1 and C2, then the body just doesn't work right. And so they've actually, in this paper, they adjusted this first patient who was 26 years old. They adjusted her a few times gently, and she had a 90% improvement within 5 visits. That was really cool. That's a quick turnaround. And then the second one here, case 2, was an 18-year-old woman who complained of left ear pain that had begun 3 months previously. When she awoke one morning with it, it kind of came on out of nowhere, and it was a 7 to 8 out of 10 level. They worked on C1, C2, and C3, and noticed improvement shortly thereafter. The third case was a 52-year-old woman who complained of bilateral ear pain. With her, they actually just did TM work, so the TMJ right here can refer back to the ear, as well as the TM can refer to the upper cervical, and the upper cervical can refer back and forth. So these 3 areas here, the inner ear, the TM, and the upper neck, are very interrelated, very connected. And so anyways, in this third patient, they just did some TM work, and that helped relieve the ear pain. And the 4th case, so 3 out of 4 cases had upper cervical correction. The 4th case here was a 77-year-old man who complained of right-sided ear pain, neck pain, and headache that had developed insidiously 9 months previously. Was treated with manipulation of the right ear, mobilization directed to the upper cervical joints bilaterally, and a little bit of work on the TM. And after that, he rated 0 out of 10, so his pain resolved entirely with that combination of things. And again, upper cervical chiropractic care is that correction of the upper neck, and we do that every day in the office. And we see patients all the time with ear pain reduce and relax, and this is just a good showing of that, and a great little bit of a discussion at the end here. It says, pain from the cervical spine may refer to the ear. Feinstein et al. Found that when 6% saline solution was injected into the to the upper cervical spine, they reported that the C1 dermatome included the ear, so it would refer to the ear, as well as C2 and C3, so those top three bones. And then as well, the last part of the paper here, they say mobilization and manual manipulation was applied to the upper cervical spine in 3 of these 4 cases. The decision to apply this treatment was based on, first, the presence of painful joint dysfunction at the joint involved levels, and referred pain from the cervical spine in the secondary ear pain. So it may be advantageous for otolaryngologists or ENTs and primary care physicians to have at their disposal clinicians who are skilled at the examination and manual treatment of the upper cervical spine and the musculoskeletal system in general, who can provide input regarding resolving these inner ear pain issues. So it just makes sense, the upper neck refers to the ear and the TM. It's a direct nerve connection in some cases, and literally just a few visits we can correct that upper neck gently without twisting or popping, balance the head back on the upper cervical spine, and help with that inner ear pain and problem there. So this is a great paper. It's in PubMed, easy to access there, published in 2011 by the Journal of the Canadian Chiropractic Association, 4 quick cases. So if you are interested in finding out more about ear pain and where you can get help with that, you can give our office a call, and we can direct you to the nearest person to you that might be able to help. We are in Portsmouth, New Hampshire, and our office is called Irritation Chiropractic. And I hope you have a great day, and we'll talk to you soon, hopefully next week or 2. All right, take care. Have a good day. Bye-bye.